Hey guys, today I will demonstrate some of the data we have collected in an attempt to develop this idea called personalized mechanistic based pain medicine. My name is Kristian Petersen. I work at Aalborg University in Denmark, and on top of that, I'm also the chair for the special interest group for musculoskeletal pain under ISP. So I think it's important that we start by defining what is this concept actually of personalized mechanistic pain medicine. And before we do so, it is important that we start to study how we actually treat patients with osteoarthritis today. And it is so that we have this thing called the treatment pyramid, and it symbolizes that all patients should be receiving treatments from the bottom, and less patients should be receiving treatments from the top. And it is so today that all patients should be prescribed exercise-based therapy in combination with patient education. Then some patients should have pharmaceutical therapies. This is normally NSAIDs and paracetamol. And then fewer patients should have surgery. And when we discuss surgery, we are commonly discussing total joint replacement surgery. And we know that this sort of treatment pyramid actually works. We know that many patients benefit from these therapies. But we also do know that some patients seem to benefit more than others. And the idea of personalized mechanistic pain medicine is actually trying to predict how well a patient will respond to the therapy. So you can say today we have this sort of treatment paradigm where all patients are treated equally. They are all receiving the same sort of treatment paradigms. But in the future, we actually do hope that we somehow can use these mechanisms to predict which patient will actually benefit from which therapy. So you might say that we want the right treatment for the right patient at the right time. And this is what we're trying to develop. So are we there yet with this concept? No, we're absolutely not there yet, but we're trying to develop it. And I would like to show you some of the data that we have actually developed over the years. I think one of the most fundamental and important facts that you can take away from this video here is that pain in osteoarthritis is actually very complex. So often when you talk about pain in osteoarthritis, you think about an X-ray image or cartilage degeneration, but it is very important to understand that pain in osteoarthritis is much more than just cartilage damage. So there's so many different factors that play into why patients experience pain and why some patients experience more pain than others. And I think these mechanisms might be the key to developing new therapies in the future and even to streamline the treatments that we already have today. And I would like to give you some examples of this. So as I told you, we know that total knee replacement surgery is a good therapy for patients with knee osteoarthritis. Many patients benefit tremendously from this. But what I didn't tell you was that 20% of patients experience chronic postoperative pain after surgery. So in the first study I'll show you here, we tried to somehow predict which patients were more likely to have chronic postoperative pain after surgery and which one did not. So what you see here is two graphs. One is an orange graph. Those are the patients who in the future or 1 year after surgery will have chronic postoperative pain. And then we have the blue graph, which are the patients who were almost pain-free 1 year after the surgical procedure. And what we did was that we assessed pain sensitivity before surgery. And what we found was that those patients who were very pain sensitive before surgery, they actually also had more chronic postoperative pain than the other group, somehow indicating that if you're pain sensitive before surgery, you're more likely to have pain after surgery. And the very interesting thing is that this sort of idea of you being pain sensitive and not responding to surgery is not just true for surgery. It's actually also true for NSAID therapies. So this study here, we assessed patients before and 3 weeks after NSAIDs and paracetamol. And what we found was exactly the same thing, that those patients who were pain sensitive before we initiated the therapy, they benefited less from the therapy itself. So it seems that if you're pain sensitive, you're less likely to benefit from standard pain therapies. Now, this is of course only one domain of pain in osteoarthritis, but we've recently moved into the area of trying to understand inflammatory markers. And inflammatory markers can be viewed in many different ways. The way that we have done it in this study that you see here is that we have developed networks of inflammatory markers. So not just studying a single marker, but seeing how these markers work in synergy. And the first important finding from this study was that we could see that if we study these inflammatory networks, we can actually define patient groups who are either very inflamed or not so inflamed. And the interesting thing with this study was that we assessed this before we initiated total knee replacement surgery. And what we found was that group who was inflamed before surgery, they were actually also benefiting less from the surgical procedure in terms of pain relief. Somehow saying that if you study these inflammatory markers, you might be able to use this as a predictive marker for which patient will benefit or not benefit from the surgical procedure. So where are we heading with this field? Well, I think it's super important to study and to acknowledge that pain in osteoarthritis is more than just cartilage damage. We need to study these mechanisms. What we also need to do is that we need to study the predictive value of these mechanisms. And more importantly, it is important to combine the different markers to develop really, really good predictive models of how patients respond to therapy. And if we are lucky in the future, I think it is also important that we try to see, can we target these specific mechanisms in order to develop new therapies for patients with osteoarthritis. This was my very brief introduction to this very fascinating concept. But for now, I would actually just like to thank you for your attention, and I hope to see you soon. Thank you.